Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc.
So I've been joined in the studios by the ever beautiful, ever green Dr Emefa Dzide from the Agbawi Municipal Hospital. Good afternoon, Doc.
Afternoon.
And you're welcome.
Thank you.
How has the day been so far?
By God's grace, very good.
Not too
stressful.
Not too stressful at the hospital, yeah? Okay, so today we are going to be looking at developmental delays in children. You know, sometimes when we give birth, the usual expectation is that by a certain number of months, the child should be crawling, walking, talking, and all that. But then sometimes some of these things delay, and then it poses challenges for parents. So today we are going to be looking at developmental delays in children. So let's quickly get into the conversation. So first of all, we want to understand when somebody says developmental delays in children, what exactly does that mean?
Okay, yes. So when we talk about developmental delays, we are referring to the developmental milestones. So the milestones are generally the expectations for their capabilities based on their age group. Yeah, so we know usually by the first 3 months, the baby is able to smile. At a point, they start pointing at things. At a point, they're able to wave bye-bye. Probably 9 months, a year, they start talking and all that. So once you realize that the time frame has passed and the child has still not shown signs of those milestones, then we call that the developmental delay.
Okay, so we want to know, are there types? And then if there are types, what exactly causes these developmental delays in children?
Okay, so the types, there are usually 4 main types of delays. We have the motor skills, we have the linguistics, that's the language, so speech, to understand speech and to be able to communicate. We also have the social skills delay, and then there's the cognitive skill delay, where there's you see they are not able to connect actions and consequences. There's their thinking processes is not working very well. They're not able to adapt very well, remember certain things, that if I do this would happen,
and all that.
Yes.
And then I guess the motor skills has to do with movement.
Yes.
Okay.
So we have the gross motor skills, so that's like the bigger movements, walking and crawling, and we have the fine motor skills, that's like being able to hold an object, hold a pen, hold a key, those kind of things. Those are the kind of motor skills.
Okay, so now we want to know, for example, I've given birth. Are there any specific signs that I need to look out for that would show beforehand that probably my child would experience some of these developmental delays? Or are there any signs that I should look out for when it comes to my child's development?
Okay, let me take you back just a little bit. So let's talk about the causes.
Okay.
So once you have one of those risk factors, then you know that probably you might have the delay. So the causes sometimes is the genetic effect. So if maybe there's a genetic effect like Down syndrome, Fragile X, maybe you know that there's something in your family line or your husband's family line, those kind of things. You might be anticipating that. Sometimes they can do the genetic testing whilst you are pregnant. At other times too.
Oh, whilst you are pregnant?
Yes.
Okay.
Yes. Especially those who are the older first-time mothers. So if you are above 35 years and you are now getting pregnant for the first time, the risk of those things are higher.
Okay.
Aside that, there's things that happen during pregnancy. So if there's exposure to certain toxins, like lead poisoning and other things, or maybe alcohol abuse, drug use, illicit drug use, heroin and those kind of things, smoking weed, smoking cigarettes during the pregnancy, they can all lead to potential effects on the baby. Then there's also the birth adverse events. So if there's prematurity, there's low birth weight, then those are signs that there might be a developmental delay in the future. Sometimes there's a difficult, prolonged labor.
I was just about to ask that.
So we have what we call hypoxia, that the child is not able to breathe very well because maybe the head is stuck coming out and all that. So that lack of oxygen
to the head
brain can also lead to eventual delays as they are growing up. And then there's also infections. So as a child, as a baby, if they get something like meningitis, if they get maybe an ear infection, it can lead to deafness. but you might not notice because the child is so small. You might not notice that the child has
can't
gone
hear.
deaf.
Yeah.
Yes. So things like that as well. So there are a lot of different things that can happen in the very from the natal stage to
right until the time that you give birth.
Yes.
Okay.
So once you have all those things happening in there, then you should be thinking probably there might be a developmental delay.
Okay.
Yeah.
But then, as I mentioned, let's look at it. Now the child is here. Are there any signs that, that can warn you or alert you that the child might be facing certain challenges?
Yes. So we look at, the normal thing. So especially if you are probably you've had a child before, or maybe you are not a
you're not a first-time mother, or even maybe you have someone with you who knows.
Experience seeing a baby growing up and all that. Yeah. So in cases like that, you would notice that at this age, maybe by 6 months, the child is still not able to sit up right. Usually by 3 months, the child can sit up right, pushing and all that. But 9 months, the child is still not able to sit up. When you leave the child, he still flops and all that. Yeah. So you can be able to tell those kind of things. Those are serious signs that maybe the child is not developmentally catching up. Sometimes too, the child is not able to bear weight. So by age 1, at least if they can't walk, they should be able to stand at least. But when they are not able to stand at all, then you know that the motor skills are not very well. And then with the speech, that one you see the speech delays in the children. 1 year, 1.5 years, still not saying any words at all. And it seems like they don't even understand when you are trying to call their names and those kind of things. When they are older, maybe by age 2, 3, when you try to let them draw a circle, they still can't follow and draw the circle. They can't understand simple instructions. And a lot of time when they are older like that, usually they like to play with toys, but you see that the child is not interested in playing with toys, even though they are 2 years, 3 years
they're
old.
Always isolated.
Yes. And also pointing at things, gesturing and all those things. So once you realize that the child is past a certain age and still not showing any signs of being able to do certain things, then those are the warning signs that there is a significant developmental delay. And one thing I want to mention is the developmental delays, they can be individual specific delays, or they can be what we call global delays. So when we have 2 or more different skills being affected, so maybe they have motor skill being affected and then speech delay as well, then we call it a global delay. Usually we see that in those who have maybe cerebral palsy and Down syndrome sometimes. Yeah.
Okay. So let's quickly look at this. Once you've identified the signs, how do you determine the extent of the delay? And then also, do these delays come with any other related conditions? For example, if maybe the motor skills development has delayed, does it come with any other health conditions, or is just the delays that happen?
So the delays, depending on which delays, they can affect. So maybe if there is the speech and then the understanding part is not there, then it will affect the thinking, because it's the speech that you use to teach the child how to think and how to. So if one is affected and you don't try to correct it early enough, it might affect the others. If the social skills are not very good, it might affect the motor, because they might not want to engage in activities which will build up their motor function as well. Yeah, so but generally there's the recommendation that you should be taking the child to see a pediatrician for assessment, especially assessment of their hearing and their speech and their sight at a very early age. Yes, so by 6 months you should start thinking about assessing the child's hearing, especially if
so they can pick it up early if there's anything like that.
Especially if you notice certain signs that maybe you shout, you make a noise, everybody will turn, but the child will not turn around to look, those kind of things. So you get a little clues from the baby's behavior, and as early as 6 months you can start doing different assessments.
Okay, so we want to know, how are these delays treated? Like, what are the treatment options? Is it through maybe you give medication and then now the child is able to or like how exactly do we deal with these delays?
So the treatment is actually tailored specifically to the type of developmental delay. So if we have something like a speech impediment, that kind of thing, yes, so we'll have a speech therapist and all that. If it has to do with social skills, we'll have to see maybe an occupational therapist. If it has to do with the motor coordination, the motor skills, you might need a neurologist, especially if there is brain damage
somewhere.
Yes, you need a neurologist. You might need a developmental pediatrician. So there are different kinds of specialties that focus on specific difficulties that the child may have. So and if it's a global one, that means you have to be having different
people for different reasons.
So it's not one size fits all. It's tailored according to not just the child disability or the child's developmental delays, but also to the parents, their work schedule, to their social conditions, how they live, who they live with. So all those things come into play before they can determine what is the best mode of treatment
for the child.
Yeah.
Okay. Okay, let's also quickly look at this. How do we support these children? What is the role of parents, guardians, siblings, family, whoever in supporting the development of children, like when it comes to the home?
Okay. One thing I didn't mention in the causes of developmental delays, sometimes adverse events in the child's life. So child abuse is also a cause of a developmental delay. Sometimes they might even have that ability, but because of the abuse, they will regress.
Stop. Yeah.
So the child will be able to use the washroom himself or herself, but after the abuse, then they will regress back to wetting the bed, soiling themselves and those kind of things. Sometimes even just being a witness to an abusive situation, not being abused,
not being the victim,
can also lead to that. Parental neglect also leads to that. And recently there's a growing concern about screen time of the babies.
Yeah, yesterday I saw this research where they said they realized that a lot of the children who are exposed to a lot of screens, now their cognitive abilities are slower, because I say they are always on the screens.
Yes. So it's actually been linked. There's a number of different researches that has linked the excessive screen time to increase in the occurrence of conditions like attention deficit disorder,
ADHD,
autism spectrum disorder as well. Aside that, they've realized that it also slows down especially their social skills. So instead of engaging with other human beings,
they are focused on their tablets. Yes.
So they don't know how to have eye contact with other human beings. They don't know how to relate. They can't read social cues and those kind of things. So it's difficult for them to assimilate once they have to go into a public situation and things like that. So what you have to try to, let's say, be careful and then avoid screens. I know there's a pediatrician right now who is doing a campaign for us to stop all screens for children under 3 years of age. So whether it's school, church,
home,
wherever, because she's realized in her work that there's an increase in the children who have those delays in motor function as well.
But they deceive us that when they watch cartoons, it makes them smarter.
Not necessarily. It depends on how much, yes. Because to her, it's like the screens are the cause of the problem. So you can't use the screen as the solution. So you keep the child will be crying all night, then you give them the screen and then they stop crying. So you think that's the solution, but it's actually worsening the child's ability to be able to socialize and then do other things. Yeah.
Okay. So finally, because of time, let's quickly look at what resources are available for families who are dealing with children who are suffering from developmental delays. I know you've mentioned that you need to go to your pediatrician regularly so that they can assess the child and all that. But then aside that, are there any other forms of support or resources that are available for these families?
Okay. Well, right now, not really so much so, but usually on the internet, on YouTube, as I mentioned, this doctor, I think Dr. Brewer, I've forgotten, mild child brain or something. She's on YouTube, Facebook, everywhere. She talks about developmental milestones, how to notice all those things. So once you are proactive, you look on the net, you would find a lot of videos and articles that would show you what you're supposed to expect for your child.
What
at
to
the
look
different
out
age.
for, what to do, what
Yeah.
not to do.
Yeah.
Okay.
So you have to be proactive as a parent.
Be proactive as a parent. Thank you so much, Dr. Emefa Dzide. As always, I mean, it's always insightful talking to you. Like today, I've learned a lot. I've put it in my pocket for the future. So thank you so much, and we'll see you next week.
Sure.
This is the